Cataract. Introduction. Cataract refers to the clouding of the natural lens of the eye, which leads to a decrease in vision. It is one of the leading causes of blindness worldwide, particularly affecting the elderly. Cataracts can develop slowly and impair vision over time, but in many cases, they can be treated effectively through surgery. Understanding the causes, symptoms, diagnostic methods, and treatment options is crucial for managing cataract-related vision impairment and preventing further complications. Definitions. American Academy of Ophthalmology, AAO. A cataract is a clouding of the lens in the eye that affects vision. Cataracts can develop in one or both eyes and can cause blurry vision. World Health Organization, WHO. Cataract is a condition where the eye's natural lens becomes opaque, leading to vision impairment and, in severe cases, blindness. Risk factors. Age. The primary risk factor for cataracts is aging, with most cataracts developing after the age of 60. Genetics. Family history and genetic predisposition can increase the risk of cataract formation. Health conditions. Diabetes. High blood sugar levels can accelerate cataract formation. Hypertension. High blood pressure has been linked to an increased risk of cataracts. Obesity. Obesity can contribute to the early onset of cataracts. Lifestyle factors. Smoking. Tobacco use increases the risk of cataracts. Excessive alcohol use. Drinking alcohol in excess has been associated with a higher risk of developing cataracts. UV radiation. Prolonged exposure to ultraviolet, UV, light can damage the eye lens, leading to cataracts. Poor diet. Lack of antioxidants, example vitamin C, vitamin E, in the diet may contribute to cataract development. Trauma and injury. Previous eye injuries or surgeries can lead to cataracts. Medications. Long-term use of corticosteroids can increase the risk of cataract formation. Etiology. Cataracts are typically classified based on their cause and location. Age-related cataract/senile cataract, a specific type of age-related cataract that typically occurs in people over 60. The most common type, occurring with aging. Lens proteins degrade and form clumps, causing blurry vision, glare, and difficulty seeing in low light. Congenital cataract, present at birth or developing in childhood, often due to genetic factors or maternal infections during pregnancy, example rubella, requiring early intervention to prevent developmental vision problems. Traumatic cataract, caused by eye injuries, leading to lens damage and clouding. It can occur from physical trauma, chemical burns, or foreign objects, often requiring surgical intervention. Secondary cataract, develops as a result of other medical conditions like diabetes, steroid use, or post-surgery complications, leading to vision loss and requiring treatment based on the underlying cause. Radiation-induced cataract, caused by prolonged exposure to radiation, example from cancer treatments, leading to lens opacity and vision issues. Early detection and monitoring are key for managing this type. Types. Nuclear cataract, affects the center of the lens, causing the lens to become yellow or brown, leading to difficulty seeing in low light. Cortical cataract, characterized by white, wedge-like opacities in the outer layers of the lens, leading to blurry or distorted vision. Posterior subcapsular cataract, develops at the back of the lens, causing difficulty reading and problems with glare. Congenital cataract, present from birth, causing blurry vision or blindness in children if not treated. Pathophysiology. Aging or genetic mutation causes lens protein degradation. Down arrow. Lens proteins clump together, forming opacity. Down arrow. Clouding of the lens reduces light transmission to the retina. Down arrow. Decreased oxygen and nutrient supply to the lens cells impairs lens metabolism. Down arrow. Accumulation of damaged proteins and lipids in the lens fibers. Down arrow. Lens becomes progressively opaque, leading to blurred vision, glare, and difficulty seeing in low light. Down arrow. Progressive loss of visual acuity and contrast sensitivity. Down arrow. Potential long-term effects, complete loss of vision if untreated, requiring surgical intervention such as cataract extraction and lens replacement. Clinical manifestations. Blurry vision, the most common symptom, especially in dim light or at night. Increased sensitivity to glare, difficulty seeing in bright light or when exposed to headlights at night. Fading or yellowing of colors, colors may appear dull or faded, making it difficult to distinguish between similar shades. Difficulty seeing at night, due to reduced contrast sensitivity. Double vision, the development of multiple images in one eye. Frequent changes in prescription eyeglasses, a need for frequent updates to eyeglass prescriptions as the cataract progresses. Diagnostic evaluation. 1. History taking. Patient's complaints. The physician will inquire about visual symptoms such as blurry vision, glare, difficulty seeing in low light, and changes in color perception. The progression of symptoms is also important, as cataracts develop gradually over time. Medical history. Conditions such as diabetes, hypertension, or previous eye injuries may increase the risk of cataracts. The doctor will also ask about any medications the patient is taking, particularly long-term corticosteroid use, which can contribute to cataract formation. Family history. Since cataracts can be hereditary, understanding if any family members have had cataracts helps assess the likelihood of genetic predisposition. 2. Physical examination. Comprehensive eye exam. The doctor performs a thorough eye exam to check for cataracts and other eye conditions. This includes testing visual acuity, the sharpness of vision, using an eye chart, typically with the patient covering one eye at a time. Any reduction in visual acuity may indicate cataract formation or another vision problem. Pupil response. The doctor checks the reaction of the pupil to light, pupillary reflex, and may also observe the movement of the eyes to assess coordination and rule out other eye conditions. 3. Slit lamp examination. Purpose. A slit lamp is a high-powered microscope with a light source that allows the physician to examine the structures of the eye in great detail, including the lens, cornea, and retina. Procedure. The doctor uses the slit lamp to illuminate the lens and look for any cloudiness or opacity, which are signs of cataract development. The examination allows for precise detection of cataracts, including the type, nuclear, cortical, posterior subcapsular, and the extent of clouding. Lens opacity identification. The slit lamp helps determine the degree of opacity, which directly correlates with visual impairment and helps guide treatment decisions. 4. Fundus examination. Purpose. The fundus examination focuses on the retina and the optic nerve to evaluate the health of these structures. Procedure. Using an ophthalmoscope, the physician examines the back of the eye, including the retina, optic disc, and blood vessels. This is essential for ruling out other conditions that could affect vision, such as diabetic retinopathy or macular degeneration, and to ensure that the cataract is the primary cause of visual impairment. Retina and optic nerve health. In the presence of cataracts, the doctor may also assess whether the cataract is blocking the view of the retina and optic nerve. This helps identify any secondary problems like retinal detachment or glaucoma. 5. Visual field testing. Purpose. This test helps determine whether there is any loss of peripheral vision, which may indicate a more advanced cataract or the presence of other eye conditions like glaucoma. Procedure. The patient is asked to focus on a central point while detecting lights or objects that appear in their peripheral vision. A decrease in peripheral vision can be a sign of significant cataract formation, glaucoma, or other conditions that affect the visual field. Significance. A visual field test is important because cataracts typically affect central vision first. If the patient has significant peripheral vision loss, it may indicate additional ocular conditions. 6. Tonometry. Purpose. Tonometry measures the intraocular pressure, IOP, inside the eye, which is an important test to rule out glaucoma, a condition that can lead to optic nerve damage and vision loss. Procedure: there are various methods to measure IOP, but the most common is the Goldmann applanation tonometer, which gently touches the surface of the eye after applying numbing drops. Another method, the non-contact tonometer, also known as the air puff test, uses a puff of air to measure pressure without touching the eye. Significance: while high IOP is a major indicator of glaucoma, normal IOP does not rule out glaucoma. This test is particularly important for patients with cataracts, as they may also have glaucoma or be at higher risk for it due to the increased pressure from a cloudy lens. 7. Optical coherence tomography, OCT. Purpose: OCT is a non-invasive imaging technique that provides detailed cross-sectional images of the retina and the anterior segment, front part, of the eye. It allows for high-resolution imaging of the eye's structures. Procedure: the patient's eye is placed in front of the OCT device, and a laser is used to scan the retina and lens. The device creates detailed images of the lens opacity and provides information on the thickness and structure of the retina and the macula. Significance: OCT is especially helpful in detecting early cataract changes and assessing any potential retinal complications, such as macular edema or diabetic retinopathy, which may need to be treated before cataract surgery. The clarity of retinal images can also guide treatment decisions, as cataract surgery may affect the clarity of the retina. Medical management. Eyeglasses or contact lenses, early stages may be managed with corrective lenses to improve vision. Lifestyle adjustments, wearing sunglasses to protect the eyes from UV radiation and managing health conditions like diabetes and hypertension. Pharmacological management. No specific medication can reverse cataracts, but controlling underlying conditions such as diabetes can help slow progression. Surgical management. 1. Phacoemulsification. Procedure: this is the most common and preferred method for cataract surgery. It involves the use of high-frequency ultrasound waves to break up, emulsify, the cloudy lens into small fragments. These fragments are then suctioned out through a small incision. After the lens is removed, a synthetic intraocular lens, IOL, is implanted in its place. Advantages: it is minimally invasive, requiring only a small incision, which reduces recovery time and risk of complications. This procedure is typically performed on an outpatient basis. Indications: phacoemulsification is suitable for most cataracts, especially those that are not excessively dense or complicated. 2. Extracapsular cataract extraction, ECE. Procedure: in cases where the cataract is too dense or advanced for phacoemulsification, extracapsular cataract extraction is performed. This method involves removing the cataract in one piece, leaving the posterior capsule of the lens intact. The cloudy lens is manually extracted through a larger incision. After removal, an intraocular lens, IOL, is inserted. Advantages: it allows for the removal of very hard cataracts that cannot be broken up effectively with phacoemulsification. However, it requires a larger incision and typically requires stitches for closure. Indications: ECE is usually recommended when the cataract is too dense, or when there is significant damage to the lens capsule that makes phacoemulsification unfeasible. 3. Lens replacement, intraocular lens implantation. Procedure: after cataract removal, whether through phacoemulsification or ECE, a synthetic intraocular lens, IOL, is implanted into the empty lens capsule to restore vision. The IOL is typically made of biocompatible materials like silicone, acrylic, or hydrophobic polymers. Types of IOLs: there are different types of IOLs available, including monofocal IOLs. These provide clear vision at a single distance, usually far, and the patient may need glasses for near or intermediate vision. Multifocal IOLs. These provide clear vision at multiple distances, near, intermediate, and far, reducing or eliminating the need for glasses after surgery. Accommodative IOLs. These lenses move inside the eye to help with focusing at different distances, offering a more natural range of vision. Toric IOLs, these are used for patients with astigmatism, helping to correct the refractive error along with the cataract. 4 femtosecond laser-assisted cataract surgery, FLACS. Procedure: femtosecond laser is used to assist in the cataract removal process. The laser is used to create the initial incision, break up the lens, and sometimes even soften the cataract. Afterward, the surgeon performs the removal of the lens and implantation of the IOL. Advantages: this method can improve precision in the incision, reduce the need for manual lens fragmentation, and enhance overall outcomes. It can also help to create more accurate corneal incisions and a more stable IOL placement. Indications: FLACS is generally used for patients who want higher precision and those with complex cataracts. It also allows for more customization in surgery. 5 manual small incision cataract surgery, M.Sc. Procedure: this surgery involves making a small incision in the eye, typically 6 to 7 mm, to remove the cataract and implant an IOL. It is often performed in areas with limited access to advanced technology. Advantages: M.Sc is effective for very dense cataracts and is performed with fewer resources, making it more accessible in low-resource settings. Indications: it is often used in developing countries or in cases where phacoemulsification or FLACS is not available. 6 vitrectomy, in combination with cataract surgery. Procedure: in cases of cataract combined with vitreous disorders, such as retinal detachment or diabetic retinopathy, vitrectomy, removal of the vitreous gel, may be performed along with cataract extraction. This can improve visibility for retinal surgery or improve vision in cases of vitreous hemorrhage. Advantages: this allows surgeons to address both cataract and vitreous issues in one surgery. Indications: this combined approach is indicated for patients with retinal diseases that also have cataracts. Post-surgery care and recovery. After surgery, recovery time is generally quick, especially with minimally invasive methods like phacoemulsification. Patients may experience some discomfort or blurry vision initially, but this typically improves within a few days. Postoperative care includes using prescribed eye drops to prevent infection and inflammation, wearing an eye shield, and attending follow-up appointments to monitor healing. Complications: potential complications can include infection, bleeding, inflammation, or IOL displacement, though these are rare and treatable. Dietary management. Antioxidant-rich diet, a diet high in antioxidants, vitamin C, vitamin E, lutein, and zeaxanthin, may help slow cataract formation. Foods to include: leafy greens, carrots, citrus fruits, nuts, seeds, and bell peppers. Omega-3 fatty acids, found in fatty fish like salmon, omega-3s support overall eye health and may reduce the risk of cataracts. Other sources: flax seeds, chia seeds, walnuts, and hemp oil. Vitamin A, essential for eye health and may help reduce the risk of cataracts. Foods to include: carrots, sweet potatoes, spinach, and kale. Zinc, important for the health of the retina and may protect against cataract development. Sources: meat, shellfish, legumes, seeds, and nuts. Beta-carotene, a precursor to vitamin A that may reduce the risk of cataract formation. Found in carrots, pumpkins, spinach, and mangoes. Limiting alcohol and smoking. Reducing alcohol consumption and avoiding smoking can lower the risk of cataract development, as both are associated with increased oxidative stress. Proper hydration. Staying hydrated supports overall eye health, helping to maintain the lens's clarity and reduce the risk of cataracts. Healthy fats. Incorporating healthy fats, monounsaturated and polyunsaturated fats, into the diet may protect the lens from damage. Sources: olive oil, avocado, and nuts. Nursing management. Diagnosis: risk for impaired vision. Interventions. Schedule regular eye exams. Ensure the patient has regular check-ups to monitor their eye health and detect any changes early. Educate on cataract symptoms, teach the patient to recognize signs of cataract progression, such as blurry vision, glare, and difficulty seeing in low light, and when to contact the doctor if symptoms worsen. Encourage follow-up, remind the patient to attend follow-up appointments to regularly check their vision. Diagnosis, risk for post-operative infection. Interventions. Administer antibiotics, provide any prescribed antibiotics before and after surgery to prevent infection. Check the surgical site, regularly inspect the surgery site for signs of infection such as redness, swelling, or drainage. Teach proper aftercare, educate the patient on how to care for their eye after surgery, such as keeping it clean and avoiding touching it to prevent infection. Use sterile technique, follow strict hygiene and sterile techniques when handling the eye or applying eye drops to prevent infection. Diagnosis, risk for discomfort. Interventions. Manage pain, provide pain relief as needed to ensure the patient is comfortable after surgery. Watch for complications, monitor for any increase in pain or pressure in the eye, which could indicate infection or other complications. Offer comfort measures, suggest using an eye shield while sleeping and encourage the patient to rest their eyes to help ease discomfort. Diagnosis, risk for visual decline. Interventions. Promote healthy lifestyle, encourage the patient to eat a diet rich in nutrients that support eye health, such as leafy greens, carrots, and fish, and to stay active. Encourage UV protection, advise the patient to wear sunglasses with UV protection to shield their eyes from harmful sun exposure. Help with smoking cessation, if the patient smokes, encourage them to quit, as smoking can worsen cataracts. Recommend regular eye exams, stress the importance of regular eye exams to detect problems early and manage any issues promptly. Prevention. UV protection, wear sunglasses and hats to reduce UV exposure. Healthy lifestyle, avoid smoking, limit alcohol consumption, and maintain a healthy diet. Regular eye exams, early detection can help manage cataracts before they significantly affect vision. Management of underlying conditions, control diabetes and hypertension to reduce the risk of cataracts. Complications. Postoperative infection, infection at the surgical site after cataract surgery. Cystoid macular edema, swelling of the central retina, leading to vision loss. Retinal detachment, a serious complication where the retina pulls away from the back of the eye. Glaucoma, increased pressure in the eye following cataract surgery can lead to glaucoma. Intraocular lens complications, dislocation or incorrect positioning of the intraocular lens can cause vision problems. Cataracts are a significant cause of vision impairment, particularly in the aging population. Early detection and surgical intervention are critical for restoring vision and preventing further complications. Regular eye exams, a healthy lifestyle, and managing underlying health conditions are key preventive strategies. Cataract surgery has a high success rate, and with appropriate postoperative care, most patients regain clear vision. Multidisciplinary care, including nursing, dietary, and surgical management, is essential for optimal patient outcomes.